And welcome back to Hometown Headlines Radio Edition for this Friday morning. John Druckenmiller again with you right now. And our next guest already is making sure that I'm doing my work properly, and that is making sure I'm conveying the right information. It is not the winter equinox. It's the winter solstice. Dr. Joe Biuso is here. He is the Vice President and Chief Medical Officer, and today you're also the Chief Science Officer of Hometown Headlines Radio Edition. Joe, thanks for being here. We're talking today about the flu that's going around northwest Georgia, and it's a good point to make, and it's some folks may not like to hear this right now when we're talking about the flu case. This is that time of year. It happens every year.
Yeah, well, glad to be here. And it is that time of year. People are spend more time inside, so we're closer together. And and when you deal with an illness like flu that's very contagious, as people are around each other more, illnesses like that spread quickly. And so each winter we see outbreaks of the flu, and usually different viruses, different bugs. But this is a typical time of year to see the flu. Maybe a little early, but fairly
that's what I was
typical.
going to think. Normally, isn't it really more January, February, kind of the peak months for it?
Yeah, and that's right. Probably January is when it really peaks. But, I've been in practice a long time. I've seen it peak different times of the year, and it just really depends from year to year. So not the most typical time, but not atypical either. You could see it a lot in December.
Well, it's funny. The timing right now, of course, all the schools are we're so worried about this. I say word, I mean a couple of them are still in session because this is hitting right at the time for finals and semesters. Of course, you're a kid getting a final, and all of a sudden you're saying, hey, we're closing the schools, no finals. I mean, you're like, yeah, thank you.
Unless you're the one who's sick.
Yeah, exactly. So those other kids out there, the sick kids, be nice to them. They got you out of finals, and you'll make them up, by the way. But it does seem to be that. And then, of course, we get into the actual heart of the Christmas season. There is going to be so much visitation going on, so much intermingling going on, office parties, staff parties, family events and all, and someone's going to have that bug, and that's when it's really going to start picking up.
Well, that's right. And the problem with viruses like this, you are shedding the virus before you get sick. So you have a very contagious virus, and it's spread to a person. They don't know they have the illness yet because they don't have the fever, they don't have the aches and pains, but the virus is now in them on the first day or two. So they are also spreading the virus, what we call shedding the virus, when they cough or on their mucous membranes. So they are spreading the virus oftentimes more than somebody who has the flu, because oftentimes by the time you're really sick with the flu, the amount of virus is getting less in your body. Your body's fighting that virus, and you get less and spread it less. So it's usually, a lot of times, the people who don't have the symptoms who are spreading the virus. So that's why it's important to wash your hands and not touch your mouth and eyes with your hands and things like that.
It's very practical stuff. I mean, when you sneeze or cough, try to do it into the crock of your arm. Maybe cut down on some of that. I don't want to sound, if you haven't had your breakfast yet, I apologize. But I mean, keep things from flying around. You don't want to get to somebody else. That's why you do the cough in the arm thing and all. This brand, I know I got my flu shot a little over a week ago, so I know I'm not quite protected yet. What they're saying this year is that this variety of flu, the inoculation, the vaccination, may not address this type A.
Yeah, good. It's a really good point, John. First of all, even though you've had it within a week, your body is starting to make antibodies. So you're starting, if you haven't had the flu shot, I would encourage you, go out and get the flu shot today. It begins to work very fast. Your body responds to that shot and begins to make antibodies against the flu, and it will help you. The fact that the flu changes each year. The influenza virus A does what we call mutate. It changes it, and we try to pick what we think is going to be the most common flu virus out there in the shot. Sometimes we're right, sometimes we're wrong. This year we did not get it right, and so it doesn't have the exact flu that we're seeing right now. I will say this, though, John. It still helps you fight the infection. You develop antibodies against the flu virus, so even though it's not the exact type, your body has made antibodies and will fight the other virus that you get, and you will get what we call an attenuated form of it. It means you'll get a less intense form, a less severe form. So it's still important to get the shot. It still does help, even if it's not the exact match like this year.
Well, good point on that. So no matter what, still got that shot, and they're available everywhere. You can get a shot anywhere in town right now, all over the place. Also, if you do get sick, I'm hearing this more and more now. Apparently, if you do feel the symptoms coming on, that's when you call your medical professional and get that prescription or that Tamiflu working. So if you can catch this in the first 48 hours, again, you're going to minimize this a bit.
Well, that's right. And we encourage even our employees at Floyd to, if you begin to get sick, if you have that fever, stay home so that you don't spread it, and see your doctor. And we can talk about Tamiflu in a minute, but you can get checked. You can get to see if you do have the flu, or if it's just another virus or a cold, and you can get the appropriate treatment for that. So better not to go into work, better not to spread it to other people, and that's how the virus will eventually get less and less in our community as people are more careful, and of course then there's immunity for the folks who have had the bug. So we'll get on the downhill side of this sometime, hopefully soon.
Amen to that. You talked about that, about feeling some of the symptoms and whether it's a cold or a virus. I want to point out something very quickly. If you're listening to us or even after the broadcast, go to Floyd.org, and there's a wonderful setup there. Y'all have done a real nice job setting up the community, a very common sense Q&A and whatever information about that. But one of the things I like about it the most, it shows you a box of where, these are cold symptoms and these are flu symptoms. So it's a nice, easy breakout for folks.
And you can look and see, where you fit in. But, we have 6 urgent cares. Floyd Medical Center has 6 urgent cares, and those doctors there are well-versed in treating the flu and can see you pretty quickly. We're seeing a lot in our emergency room at both Polk Medical Center and Floyd Medical Center. But, of course, most flu, if you have flu symptoms, probably the urgent care is the better place for you to go, where they can see you probably quicker and diagnose and treat you.
Talking about the urgent care and ER and all. Numbers, population, census counts here. Is it as normal time? For this, I don't mean the time of year, but the number of people coming in, is it normal, or are you seeing a little bit more, or how's that shaping up?
We are seeing a lot more. All of our, both emergency rooms have seen record numbers of people this week. And our urgent cares, I talked to one of our urgent care docs yesterday, and he said he had to take today off and get a little rest. He had been seeing so many patients, so many sick people. So this is there are a lot of people out there sick right now in our community.
You're hearing a lot of reports about that, reading Facebook, anywhere else, schools, that kind of stuff. We're talking about the importance of Tamiflu. It can help you out a little bit. It can kind of take some of the edge off this illness, but it's not the silver bullet.
Yeah, and just I really want to make that point that Tamiflu, it's a great drug, it helps lessen the effects of the flu. So it may shorten the illness and shorten the intensity of the illness. It doesn't cure the flu like an antibiotic would cure a bacterial infection. So I think there's some misconception about what Tamiflu does, in that you have to have Tamiflu if you have the flu. Most people get better when they have the flu. Lasts about a week, but you can be pretty sick. It can make you fairly miserable with the headache, the muscle aches and pains, and the fever. And Tamiflu makes the intensity less. It doesn't make it go away, and so we talk about if you get this flu, that you see your doctor. He may give you Tamiflu if you're in that window, the first couple of days, 48 hours. If you're not, he may decide not to give it to you. So, and that's okay. You'll still get better. We like to give Tamiflu for the people who have other illnesses like emphysema, heart disease, diabetes. That's where we really like to use it, so that those folks don't get very sick and their body's already under stress from those other illnesses.
Let me also, while we're talking about Tamiflu, shoot down a rumor. People are hearing this stuff on, of course, Facebook's the source of all rumors. There is Tamiflu in the community. Don't worry about that. You guys got plenty over at Floyd.
Yes, we do. I checked yesterday with our pharmacy, and I check every day. We have a good supply at Floyd, and some of the pharmacies run a little low. That's pretty typical of any drug when there is a illness breakout in the community. And but it's not a catastrophe. Even if we did not have the medicine, you will still get symptomatic relief from Tylenol, fluids, the things your mom did for you probably when you were sick with the flu.
All right, good point on that. We've got about a minute left here. The most important thing is, what can we do to maybe avoid getting the flu?
Well, we say this at Floyd to the staff, to our the people, the technologists, the nurses. Wash your hands, and when you go see somebody, shake their hand, wash your hand. When you have any interactions, because that's how it's spread, either by breathing it in when somebody coughs on you, or when you touch some person who has it, and then you touch your face. So avoid, if you cough into your sleeve, and I can't stress that enough. Wash your hands.
Heard yesterday also, in final seconds here, about a 4-foot radius from someone. Seriously, someone's over there coughing, at least get about 4 feet away from them.
Yeah, you're less likely to get the droplets and be able to inhale them if you're about 4 feet away.
All right, you can shout at them, put it like that. It's better. Keep yourself healthy. We do appreciate it. Great job as always. More information available. Go to Floyd.org. Also, we have a report on Hometown Headlines. Joe, have a Merry Christmas. Hometown Headlines, Radio Edition.